We welcome you to Infectious Insights, a case series designed to discuss challenges and offer solutions for difficult-to-treat gram-positive bacterial infections. This patient's going to go on and have 6 weeks of outpatient therapy. What makes Telavancin an optimal choice, potentially, or not, in the OPAT situation?
In the OPAT setting, Telavancin would be a good choice for this patient because it's dosed once a day. There's no therapeutic drug monitoring. With Vanco, if the patient was on Vanco and it was successful, he would need it at least twice a day. And we'd have to check trough levels, and there'd be monitoring as well. But Telavancin can be used once a day. Telavancin doesn't require drug level monitoring. Telavancin could be used, the patient could receive their medication at home because it's compatible with the use of elastomeric pumps. And the monitoring is just similar to that of vancomycin. There's no special extra monitoring. I think that's needed for patients receiving a longer course of Telavancin.
Do you want to talk about some of the adverse effects, some that may be of Telavancin in the setting, what you might talk to the patient about, things that you're looking for downstream, specifically nephrotoxicity?
Sure. Vancomycin, we know, can cause nephrotoxicity in patients and has some side effects. Telavancin is associated with causing acute kidney injury as well. And similar to Vanco, the monitoring that you would do for a patient on vancomycin as far as looking for acute kidney injury is the same as that with Telavancin. So you can monitor BMP in the outpatient setting once a week. Some people like to do it twice a week throughout the course of therapy and just monitor their serum creatinine as we go along. Other adverse effects we might see with Telavancin, sometimes patients complain of dysgeusia or a bad taste in their mouth, a metallic taste. Some patients have reported foamy urine in clinical trials, and it's important to remember that foamy urine is not associated with acute kidney injury. It's related to, in vibativ, the product, there's an extra ingredient called cyclodextrin that can produce this foamy material, and it's not there's no relation to acute kidney injury in these patients with that. But other than that, the side effects we would expect that you would see are like headache, possibly nausea. And those rates in comparative studies between vancomycin and Telavancin were similar.
Well, thank you, Dr. Reilly. Is there anything else that you would like to add about this case?
I think what's interesting about this case is, we see patients like this in a real world setting, right? And a lot of times they'll get vancomycin and will continue therapy. Often they'll throw on rifampin. You'll see recommendations to add rifampin. And oftentimes they have to go back for repeated surgeries, right? The surgeon doesn't want a post-op infection. This is tracked by the hospital. It's publicly reported. It reflects poorly on them, reflects poorly on the hospital as well. The patient doesn't want this infection. We don't want the hardware removed. It prolongs recovery period. He may have to go back to work. He may have plans. Already thinking in your mind, I have rehab scheduled. Here's what I plan to do afterwards. Nobody's thinking I'm going to have 3 more surgeries. So for initial therapy in a patient like this, the idea that somebody might have said, well, I'd use vancomycin and rifampin tells you right there, you don't trust Vanco in this situation because of the biofilm. That's why it's recommended. So with Telavancin, we already know it penetrates the biofilm, it prevents biofilm production, and it has activity against the bacteria that are within the biofilm. So my feeling is that if this patient was started on Telavancin, they may not have experienced this setback. But these are things that we see in everyday practice, these post-op infections. And in our practice, especially with an ID consult early, we would switch the patient to Telavancin and then continue it through the outpatient therapy.
Well, thank you, Dr. Reilly. This has been very insightful. I very much so appreciate your expertise in this area. And thank you for being here today. This Infectious Insights series is brought to you by Cumberland Pharmaceuticals.